Dr. Yakub here, Wildlife Hospital, Abuja. In the series of our health talks today, we'll be discussing a condition that occurs in pregnancy in some women in pregnancy called preeclampsia. What is preeclampsia? How does it come about? What can we do about it? And what are the possible complications that may come from preeclampsia? Now, preeclampsia is a medical condition that may occur in a pregnant woman, usually from the second half of pregnancy. Second half of pregnancy meaning from 20 weeks and above, up until 6 weeks after the woman may have put to bed. Usually, what exactly happens? Usually, what happens in pregnancy is that for some reasons that are not very clear so far, the woman's blood pressure begins to rise after 20 weeks of pregnancy. And then in association of this blood pressure rise, that is hypertension, there's also a situation where the woman begins to excrete a lot of proteins in her urine. Now, when these two things happen in pregnancy, that is what is considered as preeclampsia. Blood pressure rise associated with excretion of protein in the woman's urine, and particularly happening in the second half of pregnancy up until 6 weeks after delivery. Now, what is the cause? The cause of preeclampsia is largely unknown. In other words, there's no direct cause-effect association with preeclampsia that we can say that clearly, yes, it is when the woman has this or does this that she may develop preeclampsia. However, there are what are considered as risk factors for preeclampsia, meaning certain pre-existing conditions in the woman that may predispose her to developing preeclampsia in pregnancy. One of them is extremes of age, that is in pregnancy. If a woman is too young, teenage pregnancies, or elderly women, particularly women who are either teenagers pregnant for the first time or elderly women pregnant for the first time. So women in extremes of ages tend to have this risk factor, tend to have it more than women in the middle age groups. The other condition is being pregnant for the first time, irrespective of the age. Being pregnant for the first time, especially for a particular man. That is, if a woman is pregnant for the first time for a particular man, she has a greater risk of developing preeclampsia than being pregnant the second time for the same man. Such that if a woman marries different men at different times and she's pregnant for first time in different men, she may develop preeclampsia in such first pregnancies. The other thing is women who already have hypertension before they got pregnant, or women who have history of hypertension in their families have an increased risk or higher risk of developing preeclampsia. The other situation where preeclampsia is commoner, it's women who have multiple pregnancies, meaning twins or triplets or quadruplets, as it were. They tend to have higher risk of preeclampsia. And then women who got pregnant via any form of assisted reproductive technique, especially via IVF assistance. So these are the risk factors for pregnancy. Obesity, or people who are diabetic as well, or women who have kidney conditions before they got pregnant, or women who have some form of what we call autoimmune diseases. These are all risk factors. It is not, however, as if any woman who got pregnant for the first time for her husband would develop preeclampsia. No, that's not what we're saying. But it seems to be commoner in women who are pregnant for the first time. Now, if a woman develops preeclampsia, what are the things she notices or experiences? Of course, as I said before, the first thing that will be noticed, which unfortunately the woman will not see herself until she goes to a healthcare provider, is her blood pressure getting higher than normal, than usual. And once that is noticed, usually in the healthcare facility, they will check her urine to find out whether or not she is excreting proteins in the urine. Once that is established, that is blood pressure rise and proteins in the urine, then of course the diagnosis of preeclampsia will be made. Usually the woman may not feel anything at all. The simple preeclampsia, or what we call mild preeclampsia, usually does not give any symptoms to the woman, unfortunately. So she may not know. Before now, there was this association with body swelling, what we call edema, but as a sign or one of the criteria for making diagnosis of preeclampsia. But now that has been removed, because ordinarily most pregnant women have body swelling, edema, leg swelling, and all of that. And in fact, to some extent, as the pregnancy grows, usually you find out that the body swelling gets worse, to the point that sometimes even the face of the woman or a woman is swollen. So body swelling per se does not necessarily mean the woman is preeclamptic or has developed preeclampsia. However, in most cases of preeclampsia, there is body swelling. So the woman may just experience, as one of those possible signs of preeclampsia, the woman may just notice that the body is generally swollen. But that has to be considered with caution, because as I said, even in normal pregnancies, some women's body will swell without necessarily having preeclampsia. So those two things, by the time the woman has symptoms related to preeclampsia, in most cases it is getting complicated. In other words, it is getting to the severe form of preeclampsia. And this severe form of preeclampsia may come with headaches, may come with blurry visions, or sometimes sudden blindness, may come with stomach pain, particularly something like upper stomach pain, or we call it epigastric pain, or sometimes the pain is in the right upper side of the tummy, okay? And sometimes the woman may have severe headaches associated with that. Now, when these symptoms present in a woman who has preeclampsia, those are obvious signs that the preeclampsia is becoming complicated. And once it becomes complicated, it could lead to another thing, which is the elder brother of preeclampsia, which is eclampsia itself, a situation where the woman actually convulses in pregnancy. You see her convulsing or having fits in pregnancy. That's the worst form of it. When preeclampsia is not identified or recognized early, or where it is poorly managed, the woman may develop convulsions, eclampsia, that's as a complication of the preeclampsia. So, and from there, anything can happen. There are so many other things that could occur related to severity or complication of the preeclampsia, but that is not the topic of today. So, what do we do? What is expected of you if this condition is identified in pregnancy? Usually, what is done is, first and foremost, of course, it is necessary you go to an appropriate health facility that has the facilities, that is, as well as manpower to manage your pregnancy. Now, management usually involves the gynecologist and some other health personnel that may be trained to manage this situation, including your pediatrician and the rest of it, especially where delivery may be indicated early enough. But very importantly, we need to know and recognize the fact that when preeclampsia occurs, it is not usually curable or reversible until and unless the woman and the baby are separated. In other words, because it is pregnancy that caused the problem in the first place, the only cure of preeclampsia is separating the mother and the baby by either delivery, sometimes if the baby is old enough to survive outside the womb, or outright termination of the pregnancy to save the mother's life. And sometimes that is what is required, especially in environments where there are no facilities to manage extreme preterm babies, okay, as it were. So what is done in most cases is, of course, as much as possible, the doctors will push and push and push the pregnancy to a point where they believe that baby and mother can be separated peacefully. But where that is impossible, the focus of the doctors usually will be in preserving the mother's life first and risking the baby's life outside the womb. So please, of course, as much as it's not a desirable situation, but once in a while we see ourselves having to manage this situation, and it can be very painful, very emotionally draining, where you tell a first time pregnant woman that a pregnancy may need to be terminated to save her life. In most cases, women are ready to give up themselves for their babies. Of course, as difficult as it is, but for us health caregivers, usually we know that if the woman survives one pregnancy, whether the baby is alive or not, she will live to have another baby by the grace of God. So we focus more in the mother's life where that decision, that difficult decision, needs to be made between choosing the mother or the baby. And preeclampsia, especially the preeclampsia that occurs very early in pregnancy, and especially the one that is more likely to become complicated with issues that can take the mother's life away, we sometimes choose to preserve the mother's life and terminate the pregnancy. So we pray we don't get to that, but when that comes, please let's be aware that it is more important to save the mother's life first, then the baby next. Where both of them can be saved, yes, of course, efforts will be made to save both of them. Now, women who have developed preeclampsia in previous pregnancies have a risk of developing another preeclampsia in the next pregnancy. So therefore, any woman who sees herself developing it at any stage in pregnancy should always make sure that her subsequent pregnancies are managed in such centers where she survived the first one, or any other place that is adequately as equipped as where she was managed before. Thank you very much.